Hi, Micah. Thank you for the blue heart. Thank you all for joining me today. It is Tuesday. Paulita, you must be in the Philippines because you're saying good morning. Hi, Rachel. Hi, Tracy. Hi, Aurora. Thank you for the flower. Sylvia? I hope I said your name right. Hi, Blue. Is it difficult to get a job in coding? Have you watched my videos? This is an open chat, so I will be addressing this in a little bit. Rachel says, I just started medical coding class last month. Congratulations. All right, so let's go ahead and get into it. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Today I am having an open chat, so whatever questions pop up into the chat box, I will address. And I will also be talking about the progression, the career progression of medical coders. Once you've been a medical coder for a while, what else can you do besides medical coding? So let us begin. All right. Hi, Mitney. I'm doing great. Thank you for asking. So I'm going to go ahead and address Sylvia's question. She says, hi, Blue, is it difficult to get a job in coding? As if you've watched any of my videos, you know that it is a challenge. It is not easy to get a job the first time in medical coding. It takes persistence. It takes diligence. It takes you being out there and showing your skills appropriately, as far as like listing them out on your resume and having a really good resume. That's what it takes. It takes applying with a temp agency. And a temp agency, if you don't know, there's plenty of temp agencies out there who specialize in medical professions. So you can just Google temp agencies in your area for medical professionals, and you should see a bunch pop up. And they will be for nurses. And then when you start clicking on the jobs that they have, sometimes they'll have medical billing and coding listed, or sometimes just medical coding, or sometimes just medical billing. So that's how you can get your start that way. There's lots of ways. You just have to be persistent. If you are thinking that you are going to apply for an entry-level position, entry-level positions are like seeing unicorns. A lot of them are going to be asking you for experience right out of the gate. Now, since people who are already working, who have experience, are already in a place, a lot of times these employers are going to have to take what they get. And if they're wanting to hire somebody, they'll take a chance on somebody new. But you have to show that you are worthy to be in that position, that you're not somebody who's going to need a lot of hand-holding and training. That is the problem a lot of times, is that new people think, because of what their school has told them, that they're going to get a lot of medical coding training when they get in the field. Now, yes, medical coding from the book and medical coding in real life is two very different things, because you're going to have these doctors and they're going to document whatever way they want to, unless they have somebody hands-on with them to help them along, as far as like, this is documenting more detail and more appropriately rather than just whatever they want to put down. The book is going to give you very textbook examples, and it's going to be very detailed. It's going to have all the information that you need. When it comes to real life, it's going to be something completely different. So if your school is telling you, oh yeah, well, you'll learn in the real world, there are some things that you will learn in the real world, but not everything. Okay, so you will get training on like some software and things like that that is specific to that hospital or that facility. For the electronic medical record, you'll be getting training on that too. But when it comes down to the fundamentals of medical coding, that is something that you will have to know walking in. And you will have a learning curve in the beginning. Obviously, everybody does, but you will have to study, because that is your responsibility as a medical coder. So it's going to take a lot, and it is not easy. Tammy says, happy Tuesday, everyone. Hi, Simone. Thank you for the blue hearts. Hi, Yvette. Thank you for the blue hearts. Guy says, roses are red. Today is Tuesday. The coding posse should get ready. Here comes Miss Blue's day. Ha ha. Hello all. Thank you. Thank you, Guy. I like that. That's funny. All right. So career progression of a medical coder. So once you've been a medical coder for a while, you may ask, what are some of the other things that I can do? Not just limited to medical coding. Well, of course, when you've had experience and depending on the credential that you hold, if you hold a CCS or even a uh, CCSP or a CPC, you can get into those positions as a supervisory role. Now, sometimes when it comes to the supervisory role, some facilities would rather have the RHITs, who are the associate's degree holders, the registered health information technician. They would rather have them in those roles because that is what they are trained for. And also the RHIAs, which is more on the managerial side of the house. That's the one in the executive suite. That's the one making all the decisions. They are the captain of the ship. So they typically do have people who have those designations in those roles. Now, what else other than being a supervisor can you do? There's also a lead coder. Now, lead coder also goes to people who have degrees, but they can go to people who have more experience. A lead coder is sort of like the senior coder, or somebody who has a lot of knowledge and who can help coach the coders, and who can also help coach the providers when it comes to education and educating them on the fundamental facts of medical coding. So that is what lead coders do. They also assist with the audits, and sometimes they do the auditing also themselves. It just depends on what functions your facility has for the lead coder. If you're wanting to be an auditor takes experience, and it also takes education. It takes having the experience and the time in. So if you have less than 2 years, don't be looking for a auditing position. And even if you have a auditing certification, it doesn't matter because you still need to have experience. You can't tell people that they're wrong if you don't have the experience of having been told yourself that you're wrong. Now, I've been told many times in my career that I'm wrong. I've also successfully argued my way into, well, actually, it's this way, or actually it's this way. And then there's been times when, yes, I have been wrong. So it really all depends on what you want to do. And being an auditor, you're going to go through a lot. I mean, that is somebody that has experience and knowledge and is able to educate the coder as to why they are being marked wrong. A bad auditor, because there's good auditors and there's bad auditors. A bad auditor will tell you, well, it's this way because I say so. And basically they tell you this either by email form or in person, however you're doing your audits. And that's not right, because auditors should be humble and they should be educators, and they should be willing to take feedback from the coder, especially when the coder is trying to defend themselves. Now, sometimes coders will think that it's personal, and if the auditor is doing their job correctly, it's not personal. It is just the way that the codes were selected, and maybe the coder needs to be educated. There's a huge difference in it being personal and it being a professional thing. Now, sometimes, yes, it is professional, and the coder takes it the wrong way because they don't like to be told that they're wrong. Nobody likes to be told that they're wrong, but we are in a learning profession. We are always going to learn. I am always going to learn. And I've been in this 10 plus years. I'm still learning. And I am willing to accept when I'm being told, hey, well, this is wrong. And if I don't have a reference from that auditor as to why I'm wrong, I'm not going to accept it. And I'm going to stand up for myself and show my references as far as like, okay, this is how I got to this answer. And we need somebody to break this tie, because obviously I've dug my heels in, the auditors dug their heels in, and it's not going to go anywhere until somebody settles it. Now, I will take it if somebody tells me, the auditor tells me, hey, Blue, I see that this is the guideline right here. Oh man, okay, I missed that. So there's times when you have to build that in yourself too, that there's going to be times when you're wrong and you have to accept that. So, but that's one of those things that you can progress to. Take your time when you're getting into that. Hone your people skills is what I say too. Because if you don't have good people skills, you will not make a good auditor. If you don't have good research skills, you will not make a good auditor, because you have to be able to defend why you're marking somebody wrong. And everybody's going to have a different learning experience. So That's all I'm saying. The other thing that you can do is be an educator. An educator is also going to take experience. It is also going to take you having some time in. Sometimes there's people that are brand new to the field, maybe with a year experience, and thinking that they can educate other coders. No, no, no. If you don't have over 2 years of experience and time in the field, working in multiple clinics, working in multiple different settings, getting yourself in that sort of Marine Corps, if you will, of medical coding, then your knowledge base is fairly limited. And when you're passing on limited knowledge, that's what other people are going to pick up from you. So you want to make sure that you have some experience before you go and try to be an educator. And an educator will take time, whether you are training other medical coders or whether you are training providers. You have to make sure that you are poised enough with your own knowledge before you start striking out there and trying to be an educator. At least that's just my advice anyway. Hi, Ellie. Thank you for the blue heart. Hi, Misty. Andrade says, my auditor has been aggressive and doesn't like to be challenged. And that's the worst kind of auditor. I've had those. And, you know, to me, when you're showing your coding clinic or you're showing your coding guidelines and they still have an attitude or they're getting aggressive, aggressive is never, ever tolerated. Okay. That is workplace violence. You know, you don't ever want to get into something like that. But them getting aggressive, their supervisor should be brought in because that's unacceptable, period. There is no reason for that. We are civilized adults who should be able to talk this out. And if they're mad because the coder is challenging them, it is your responsibility to challenge them. According to our ethics, you have to be able to stand up for correct coding. Just because you are being forced to do incorrect coding, that is not an excuse. And you are just as culpable when it comes down to brass knuckles and they start doing investigations. Who was the coder? And then they say, well, the auditor said to do it this way. That is unacceptable. You're still culpable for it. So that's the thing. You have to be able to stand up for yourself. And if you are citing appropriate guidelines, then their boss needs to be brought in. That's all I'm saying, because that'll knock that out. Because that is unacceptable in any workplace at all. You should not have to have that worry that somebody's going to be aggressive with you just for presenting an argument. Hi, Aunt Janet. Thank you for the blue hearts. Tammy, this tells me that I need to know the guidelines inside and out. And this is why I always tell people, read your guidelines. Read them once per week and in their entirety when you are in school. If it takes you 2 weeks to complete the guidelines, then it takes 2 weeks. But just be consistent with reading the guidelines. Because if you know the guidelines, no one can take that away from you. And no one can argue with you when you can cite an official reference. Just saying. And Misty agrees. So, you know, that's the thing I tell you guys. When I tell you guys these things as far as tips of reading these coding guidelines and reviewing them, sometimes veteran coders will get out of that habit. Well, I know the coding guidelines, I shouldn't have to read them. And they stop reading them because they get updated every year. And when they get updated, you should know what the updates are. And sometimes they just sort of go with the flow on those things. But if you're not paying attention every year, you may be doing something consistently that was okay 5 years ago, but it's not okay today. So that's why you always have to stay on top of those. Those guidelines will save you every time. And especially when you know them, it's like knowing the law. When you know the law, yeah. It's the same thing with knowing the guidelines. That is our foundation. That is what we do. That is how we argue. And that is what is going to save us from our code selections. And make sure that we are coding appropriately. Because sometimes people get into the habit of, well, I don't understand this, so I'm just going to select whatever. Or the provider said to do it this way, I will just go ahead and select this because that's what they wanted. It's doctors, providers, PAs, NPs. They are not meant to be medical coders. That's why we have a job. Okay. So that's why I tell you guys, even though they select a particular code and they select a particular level, it does not mean that that is actually accurate. You have to make sure that the documentation supports the use of those codes. And Bleu is BLEU. Thank you. Hey, Bleu. Is it possible to make index cards on the guidelines? You can make index cards on anything. So yeah, if you look at them and you take the points out of there that you want to study or remember or recall, yeah. And it's all about the details. And this is why my name is such a huge deal. When I tell people my name is BLEU, because we are in a very detail-oriented field. If you transpose numbers on a code, you're going to end up with either a completely different code or an invalid code. This is why I'm telling y'all. The details count. And people tell me, oh, well, that was a, it was a typo. Okay, then correct the typo. As soon as you see the typo, correct the typo. And it's okay. It's just, I need y'all to be aware that the details are always counting. And it doesn't matter who you address. You know, when you are addressing other professionals in the field, it's important. It's just like doctors and their names too. If you misspell the doctor's name or you mispronounce the doctor's name, they have gotten mad. I've seen doctors get mad at other medical coders because they mispronounce their name, or they address them as Mr. Smith or Mr. Jones instead of Dr. Smith or Dr. Jones. You never, ever address them by Mr. when they have a proper title like doctor. If they are in a PA, you can address them as Mr. or Miss. Okay, however they want to be addressed. So that is something that you have to pay attention to. Details are really critical, and that is something that is very important in our field. Okay. Tracy says, the neurosurgeon I work with always corrects me with names. And see, that's the thing. And even with pronunciation, olecranon. I was saying that word wrong for years, but that is a medical term. But still, it was just like, I've been saying it olecranon for years, and it's olecranon. So proper pronunciation is key. Proper wording of anything is key in this field. So yeah, they will look for those things. And trust me, when you think doctors and other staff, PAs and NPs, when you think they're not paying attention to you, oh yeah, they're paying attention. They're paying attention. So don't ever let your guard down as far as how you carry yourself. You got to be consistent all the way, folks. And I'm telling y'all this because I care. I don't want y'all to make the same mistakes that I did. Okay. I've always been a good writer. I've always been a reader. I've always done a lot of these things, but a lot of times when I've had my interactions, like I've gotten nervous and I've been like, oh, you know, how do I do this? So I'm passing all of that on to you guys. Being confident in your knowledge of medical coding goes a long way, because when you are unsure and then you show the provider that you're unsure, oh, no. That is the worst thing that you can do. Even if you don't know the answer to their question, you say, you know what? Let me get you that reference on that and I'll get back to you. And literally mean to get back to them on that. Because if you don't know it, that's okay. But don't ever say you don't know. Because if you tell a provider that you don't know, they lose confidence. They lose trust in you. And it's all about building that immediate trust and that immediate confidence in their coder. Now, all my providers, oh yeah. You ask them, are you confident in your medical coder? Well, they will tell you, oh yes, I am. And they can pick me up out of a lineup, because the thing is, there's a lot of providers who say, I can't pick my coder out of a lineup. I don't know who they are. You always let the provider know who you are, because you are their teammate and you are who is going to be helping them. If there's no educator on your staff and you have to do it, oh yeah, you got to make sure that they know who you are, and realize that they have bad days too. And there's going to be times when they don't want to deal with you, and you'll be able to start learning how to read them, especially if you're around them. If you're lucky enough to be in the facility and you're around them, you'll be able to pick up on their cues, on their social cues, on what kind of mood they're in. But if you are doing this all by email, just keep in mind that email is a lot harder to build relationships than it is in person. Because in person, they can't avoid you. You're right there. But on email, they don't necessarily have to pay attention. So, and especially if you get wordy, that's another thing too. If you get wordy in your emails, you got to look at what you want to say and then cut it down to about half. And then look at that half and then cut it down to about a quarter. And that's about how much attention you're going to get from them. So make very good use of your words, make very good use of your space, which is just a few lines, but get as much information into those few lines that you can, because that's what's going to count when they're looking at, well, can I trust this person? Because a lot of times providers have a distrust for coders, especially if a coder has only gone to them telling them that they're doing things wrong. If that is the only thing that you do, oh, I only query my providers. You never tell them when you see a really great note that they did, you never share that with them. They don't know. So they only associate you with bad stuff, with, oh, you're querying me, I'm doing something wrong, I did something bad. You know, they need to know that when they see you, it's not just about the bad, it's also about the good. Now, I've had many instances where I tell my providers I'll send them an email if I can't catch them. Sometimes they'll be up in the OR and I'll send them an email, be like, eek! And I'll tell them, you know, I had to stop and tell you this really quick. I said, this was really awesome documentation, or this was very funny, or whatever, because sometimes the way they document is hysterical. But, you know, it's just like, thank you for the detail. I appreciate that, you know, and it's them knowing that is like gold. Hey, my coder thinks I'm pretty good, you know, and so that's what they like. They're human too, and they like compliments just as much as we do. So you have that ability to be able to give them a good day just by telling them that they did really good. But don't always only go to them when something is bad, because that's when they start associating you with something bad. Again, just my advice. All right, so the other thing, I've been getting a lot of resumes, and it's just people asking me to review their resumes and not scheduling appointments for this, because I do have to charge for this, guys. I can't review resumes for free, because if I did, I would literally not have any time for myself. I work a full-time job for 40 hours a week. I come home, I do live shows with you guys, sometimes for an hour, and that's another 5 hours. But there's also prep time before that. And if the show doesn't go over an hour, sometimes it's an hour and a half. It really all depends. And I also have another channel called with Patreon, also Medical Coding with Blue. But that channel requires me to do a little bit more, because I do worksheets and exercises and things like that for my viewers on that channel. So it takes a lot of time. Plus, I am a medical coding tutor, and I do have people who book sessions with me, and it is varying times throughout the week. So when I get those, or I get the resume reviews where I'm doing professional coaching and I'm looking at the resumes and we're going over what they have in there, I'm happy to do it, but I have to charge for it, because otherwise I wouldn't have no time to do anything else. So if you are sending your resume and you don't get a response, that's why. So just keep that in mind. You know, not to be like that, but I have to, guys. And I've said it many times that I have to. Otherwise, like I said, I wouldn't have any time for myself. Alive in my 50s says, hi, Blue, what do you do with all of your outdated books? So when it comes to what you should do, like recycle wise, you can always find a recycling bin to put them in there. I tend to look for people who I can give them to. Sometimes if I really use that book, then I will hang on to it. I still have books from 2019. So it really all depends on what it is. If it is a coding companion, I hang on to that for years. Same thing with the coder desk reference. I hang on to that too, because there's a lot of codes that are still really good in that book. Some people are just quick to get rid of them. You can also take them to Goodwill or Salvation Army, wherever they have like thrift stores that you can donate stuff, and just give them to them if that would make you feel better. But that's what I say. That's my advice anyway. Oh yeah, I shared your YouTube channel with my CPT class. Oh, that's good. Thank you so much. I appreciate that. Yeah, and mentoring. All right, I got asked if I could be a mentor for somebody. I got a couple of requests this last week to do it. Again, with my schedule, I try to accommodate everybody. I try to accommodate questions that come into my inbox because I get a lot of emails a week, and it's just very difficult, and it's hard to slim down time for one person. And I think that that's what mentorship calls for. If my schedule was not as busy, then maybe, but I don't have the schedule and I don't have the bandwidth to be able to accommodate somebody for mentorship right now. I always tell people, if you're interested in being mentored by me, please go through the videos. I have well over 600 videos where I'm talking about advice. And a lot of times when people are asking me to mentor, they're asking me basic questions, like basic questions about how to get into the field. Is it hard to get a job? What can I do? What should I do for building my skills as a medical coder? All of that is in my video queue. So take the time, look through the videos. And I have lots of Q&A Tuesday videos that I've done in the past. I haven't done a lot of Q&As lately because there haven't been as many questions coming in. But I think it has to do with like the season, because it's the summertime, or it was summertime, and people just were not asking lots of questions. So if that is you and you're interested in that, if you're interested in mentorship with me, then take the time to look through the videos. I do answer like individual questions, like, quick questions, but if it's an in-depth question, just try to look and see if I have a video on that, or ask me if I have a video on it, and I'll send you a recommendation that I have, or sometimes I will just respond with the video, especially if it's a basic question. So again, trying to accommodate everybody, but I'm only one person, and I don't have an assistant, and I don't do all of that website stuff and all this other good stuff. I don't do all of that. It's just me. It's just me. So all of the content is all original content. This is the stuff that I think of. This is the things that I have thought of to tell you guys. So, it's all me. This is not anything else. My inspiration comes from you all. When y'all ask me questions, or when you share with me some things that are troublesome for you, and then I share them with everybody without mentioning who you are, because sometimes a lot of people going through the same thing, and they feel guilty being away from their kids, or while they're studying. Should they do this? Is that, can they do this? Or I'm getting into this later in life. Can I do this? Yes, you can. And doing this, having children and having a family, it does not make you selfish because you want to do something that's a career thing that's going to provide for you and your family in the future. That's not selfish. That's responsible, is what that is. Misty says, "You are so amazing, Bleu." Thank you. Thank you so very much for your time. You're greatly appreciated. I appreciate that. Thank you. Renteria, I'm in school right now, third week, and I'm having a hard time taking all the notes. So it's so much. See, and that's another thing too. I got an email from a young lady that she was saying that she's just started in her medical terminology class, and it's so much and she wants to give it up. It's a lot of writing. The thing is, when it comes to being brand new into the program, and being in your third week, it's a lot, right? It's a lot of information, especially if you haven't been in school for a while, or if maybe school wasn't your thing and you're going back into school and now you have to study all this good stuff. It's better to break things down. I told the lady that was talking to me about the medical terminology that you got to break down prefixes, suffixes, and root words. Don't try to learn whole terms in medical terminology, because if you are, then you're really going to overwhelm yourself. But if you learn parts of the word and then you piece together the word, that makes your expansion of vocabulary really big, because you're learning even more words. You can piece together a lot more based on knowing the small parts of the word, the prefixes, suffixes, and root words. There's like 600 of them. That's a lot easier to learn than thousands of medical terms. And trust me, medical terminology is going to be easy. That's the easiest part. The rest of it is when you start getting into the coding, that's going to be hard. That's when you should get overwhelmed. But if you're trying to take on a lot right now, and And maybe it has a lot to do with the teacher and the way that they're instructing, but it also has to do with the student themselves and making sure that they're not taking on too much either, or thinking that they need to take on too much. If you're looking at what you have to learn and you're in the 3rd week, so I'm not really sure what subject are you on, if you can comment in the box. But if you are looking at like workbooks and you're looking at scenarios and then you have to answer the questions at the end, read the questions at the end first before you read the passage in the chapter, because that way you know what questions they're going to ask. You don't have to memorize this stuff, but you do have to be able to recall. And the quickest way to be able to recall is to know what you're looking for, right? So if you look at those questions at the end of the chapter first, then you go and you read the chapter, you're already going to know ahead of time, they're going to want to know this, they're going to want to know this, they're going to want to know this. Boom. Now you have, okay, now I know the answer. Now I know what to do here. And that's breaking it down in manageable chunks, because you already know what the end of the chapter is going to be asking you. Okay, so that's just one way to look at it. Also, when you're looking at multiple choice questions, make sure that you're looking at all of the answers that they're providing to you. Typically, there's going to be like one question that, or 2 answers that are just not going to make sense. You know they're going to be wrong. So that's going to leave you 2 answers potentially that could be correct. And when you look at those, make sure you're looking at what is the difference between the 2. Anytime I'm tutoring anybody and we're going over questions, I always ask them the first thing out of my mouth, what do you see here? What looks different? Well, or what looks the same to you? 2 of these questions, 2 of these answers are almost the same. 2 of these other answers are almost the same. Okay, now we've narrowed it down. So we know where to look and where to start reviewing. So that is just a helpful tip that I say. Make sure that you are on a schedule, even if you are in school and perhaps you're doing this independently, you're studying independently. Again, I don't know what your school looks like, but when you are working independently, make sure that you are on a schedule, because having that discipline is the first step. Because if you don't have a schedule and you say, well, I'm going to study in the morning some days and then some days in the evening, well, what if one day you can't get to it because life gets in the way? And you don't have to study 7 days a week when you are studying, when you are a student, right? Make sure that you're studying at least 5 days a week. Would 6 days a week be more preferable? Sure, but people say, well, I have family and I have other obligations and I work and that kind of thing. If that's the case, then okay. If you say, well, I work a full-time job and I'm doing this independent study, how can I fit in time? I don't have time. I've been working all day. I'm exhausted. Okay, well, you do have the half an hour that you're driving to work, half an hour that you're driving home. That's an hour already. You have 30 minutes for your lunchtime. You can also read. But in that hour, in your commute to and from work, you can listen to podcasts. You can record yourself reading the guidelines and then listen to it in the car. So that's another way of being able to do that. So look for those little pockets of time where you can squirrel in 30 minutes or you can squirrel in an hour. And that way you can sort of immerse yourself during that time in those things. And that will give you those little manageable chunks that you can be able to digest, and it'll make learning a lot easier and a lot less stressful because you're not trying to take on everything all at one time. You know, this is an adult student talking to another adult student, because I've been there. I was out of school many years before I went back to school. I was in my late 20s by the time I went back to school. And it was a new thing having to get back into it after being out of school for years. I had been out of school. I had been delivering phone books. I had gotten married. I had been going through a divorce. So I was doing a lot of things before I got back into school. And there's people that are older that have successfully gone back to school, successfully studied through a program, and are successfully medical coders now because of their persistence. So Gemini says, hi, Blue. Thank you for the blue heart. I'm self-studying and your videos have helped me so much. I'm very grateful for your knowledge. Oh, you're welcome. Gemini says discipline is key. I keep a calendar and I'm on a routine. Tamra, BLEU. We just talked about this. My name is BLEU. Now, I always tell people who are going to be medical coders, you have to pay attention to detail. And even if it was just a typo, you can put on there, this was just a typo, and correct it. Because if you get a medical code wrong, if you transpose numbers in a medical code, you either end up with an invalid code or an incorrect code. That's why I make it a big deal about my name. But Tamara says, hi Blue, I'm at the end of my coding program and I've seen a job that it will give 24 months to get my CPC. Should I apply? You finish your coding program and you don't know if you should take the job, if they're giving you 24 months to get your CPC. If you finish your coding program, you should be ready to take your coding exam, your CPC exam. And if they're giving you 24 months, that's very generous. That's 2 years. You should not wait 2 years after you've done your program to take your certification. The longer you get away from your program time, the more you're going to start to forget this stuff. So when you are in these programs and let's say you finished your program, really plan to take your certification exam within 30 days, on the outside within 90 days. So no more than 3 months from your graduation date. The longer you wait, the more higher chance that you're going to fail because you're going to forget the things like HIPAA and the OIG and all of the other reimbursement, medical reimbursement things that you need to know whether you're taking the CPC or any certification with a HEMA. So take your exam as soon as you can when you finish these programs. And if you're saying, well, Blue, I don't have money to take my test yet. Okay, but make sure that you've been planning when you're in school because you know at the end you have to pay for the certification exam. Okay? So you need to have this when you're out applying for jobs. In your case, Tamara, you're very lucky if they're willing to hire you without having a certification. But keep in mind that clock's going to start ticking the second you get that job. And if you work it up in your head and you don't take that certification in time, you're going to lose your job. So make sure that you take the certification as soon as you can. Just because they're giving you 2 years to take it doesn't mean you need to take that full 2 years to take it. I'm just saying. Tracy says, hi Tamara, I applied for several jobs that allows you a year to get your CPC. Tracy, I start my 4-week workshop after my program ends, which will entail the certification exam. Okay, so there you go. Sometimes people will kind of sit on it and wait and say, well, I'm not ready yet. If you always overthink that you're not ready yet, you're always going to overthink that you're not ready yet. I know because I've gotten emails from people who tell me, Blue, it's been a year and I still haven't taken my certification exam. Why? You had a higher chance of passing your certification when you finished your program versus later on down the line when you've been out of the program too long and you've had time to forget a lot of the things that you've learned. Rachel says, yep, that was me. I took the class years back and didn't have enough for the test. I plan much better now. And that's what it takes sometimes. Sometimes when people, they say, well, Blue, when I was younger, I was in college, but, I kind of dropped out of college. College was my thing. So I got into medical coding, just like studying for it. But, I really wish I would have appreciated my time in college back then. People are going to have different life paths when it comes to their journey and being able to take, certain paths in life as far as like school-wise goes. Sometimes people will take their degree programs and not really fully understand what they're getting themselves into. And then they kind of lose out, because they didn't know, or they don't like it because they didn't understand what it all entailed until they got into the real world and figured it out. And they're like, I don't like this. All that money and time that got invested into that degree program. Tracy says, I didn't want to wait for the next 30. I didn't want to wait for the next workshop in 30 days, LOL. Hi, Monica. Thank you for the blue hearts. What do you think is best when doing Practicode, books or codify through AAPC? So I'm assuming codify is that, what is that, like an encoder? When you're working with AAPC, is that the encoder for AAPC? Okay. You can do either. Practicode is just an educational product, and it's just meant to kind of give you more confidence with the coding. You don't need it. You don't need to sign up for Practicode. It is meant to accelerate the removal of the A from your certification. But if you already have a job, then why do you need to accelerate the A removal when it's going to come off anyway? But you can always work with the book. You can always work with codify. That is totally fine. That will give you, if you work with codify, or if you do a split, right, where you're working with some of the encoder and then you're working through the book, it's still going to give you lots of really good experience and going to sharpen your skills, because working with the book is always best. Working with codify is pretty good too, because then you'll have access to all of like the encoder and the correct codes, or if you want to look it up in the book first and then check it through codify, it's totally fine. But that would be what I would recommend. Somebody asked me to do a video about Epic and getting certified through Epic. Now, not every facility does the same electronic health record, okay? So I personally have never worked with Epic. I know of all the years of experience I've had, right? I've never worked with Epic. I would love to work with Epic someday because it's so big, but I don't have any experience, so I wouldn't be able to do a video like that. So if you want to, I'm sure there's tons of tutorial videos on YouTube, but you'll have to check that out for yourself. But I got nothing for you there. Micah says, I decided to go into medical coding. I'm having a really hard time finding a reliable coding program, hybrid or in-house, that's in New York City, particularly one that is 9 months. Have you looked at the HEMA or AAPC? It's really going to depend. Even if you go to like a college and you go to the medical billing and coding program, it does not necessarily mean that you're going to have good instruction. Sometimes you'll find really good instructors in the college, and some of the instructors in the college aren't very good. So it really all depends. If you want to go through AAPC, they have their medical terminology and anatomy separate from their coding program. Their coding program is like 4 months, and then it comes out to like 8 months. So if you go through a program that's 8 months, that's fine. What I'm more wary of is the 16-week program total thing. Okay, that I would tell people not to do. They still do it anyway, but you know, there's going to be people out there like that, the schools. So it's really all up to you. Basically, what I tell you guys to look for in these programs is that they're going to be teaching you medical terminology, anatomy and patho, medical law and ethics, and that they are teaching you the coding, the ICD-10-CM, the CPT, and the HCPCS. If they're training you for an inpatient credential like the CCS or the CCA, and you're having to learn the inpatient side, you'll be learning the ICD-10 PCS. So as long as they have all of those things, then you're good. But I only recommend going directly to AHIMA or AAPC. Both of them have their own online programs. AHIMA, they will allow you 1 whole year to complete their program. The program is just about $4,000. The same thing with AAPC, with all the other fees and everything else. It comes out, they're about the same. I don't think that the cost difference between either is too big, right? But it's roughly about that much for either one. With AHIMA, you do not have to be a member, although they do have member pricing if you are a member of their association. With AAPC, they do require you to be a member before you sit for their certification exam. And if you sit for their certification exam, you have to be a member. And once you get your certification, you have to maintain your membership, because if you do not, they will take your credential away from you. And they expect you to pay for your membership every year. So that is what I can offer you there. I don't have any relationships with any schools. I cannot vouch for any schools. and I do not expect anybody to list their recommendations in the box either, because I have blocked a lot of those names. I can't advocate for somebody that I don't know. So that's why I'm very strict when it comes to the information that's given out on my channel, because I want you guys to get pure information and information that is going to be solid. Because if I don't know the product, I'm not going to recommend it. But like I said, you can't really go wrong with going directly with the associations themselves, especially if you are planning to learn independently. Are you familiar with CPT Quick Reference app? It's an AMA resource. I've never used it, but if it's an AMA resource, it's okay with me. Micah says, I've always felt uncomfortable with completely online courses. Well, then visit the school, visit the college if that's what you want to do. If you're completely uncomfortable with that, by all means, go to the college and go that way. So that way you can get some in-house learning, and maybe you'll get lucky. You'll get lucky and there'll be somebody in there that teaches well. That's all I got to say. If that's not an option for you, working online. And I don't blame you. It's hard to learn something all online, but that's the option that we have. So. What else did I have? On this comments, Vicky says, thank you, Blue. Even though I'm still only in the beginning stages of medical coding courses, I still get so much good info from you. Thank you. And thanks for advocating for the newbies. I will always advocate for new people. In that video, I talked directly to people who were hiring, because they said, oh no, they didn't want a CCA and they didn't want a CPCA, but they said they wanted CPCs. Well, you were a CPCA at one time yourself. So what is the big deal? This is my little pet peeve. Oh, Tracy asks, can you live in one state and work remotely for a company in another state? Yes, our certifications do not pigeonhole us to one state. If the remote company allows you to be in any state, then you're perfectly fine. Your certification works worldwide. Now, some remote coding companies will expect you, some will expect you to be within a certain radius, especially if they expect you to be there for in-house meetings. That is part of their deal. But if they allow you to be anywhere in the US, they like live anywhere in the US, then that's perfectly fine. But they typically, now don't think it's that you can travel. Some people have written me and said, oh, does this mean I can travel? No, it does not, because you still have to be in one place and you have to have their equipment at one place. When I worked remotely many years ago, they have to know your address. They have to know where you are because you have their equipment, and you have to be able to supply a very secure line. So it's not just about being, oh, I can connect to Wi-Fi. You do not connect to Wi-Fi with this. We have to protect this information. Just because we are not in the hospital does not mean that the HIPAA rules do not follow us. It follows us everywhere. Isabel says, hi, Blue. Thank you for the blue heart. Speaking of medical terminology and anatomy, can you recommend any particular flashcards for self-study? When I update the video, I always list the video that has the independent study, and it has the flashcards that I do recommend. It also, if you keep scrolling down when I update the description box, it will also have another deck that I do recommend. Tammy says, AHIMA has schools that they approve of on their website with links. There might be one located in or near New York City. Thank you for sharing that, Tracy, Tammy. But yes, that is good to know. So be sure to check that out if you are interested in that, Micah. Let's see, what else do we got? I got another comment. It says, I can't get certified at the moment due to personal issues, but I'm interested in learning medical billing. Any advice for me how to start with no medical billing experience? I only want medical billing, not coding at the moment. When you become a medical biller, your job is to process paperwork. And when you process this paperwork for these different insurance companies, you will see codes. This is why it's a good job for new medical coders who can't get in medical coding right away, so they get in through billing first, because you're going to be looking at these codes. You can't say that you don't want to learn anything about medical coding because you only want to do the billing. You're still going to be exposed to a lot of the coding. And sometimes if you are starting brand new and you have no experience, no background, no anything, you do not have to be certified to be a medical biller. If you look at the job postings for medical billers, they're not asking you to be certified. All they're asking is for a high school diploma or a GED. Sometimes they're asking you to have experience, sometimes not. It really all depends. But if they're not asking you to have experience, then by all means, take your transferable skills, put them on your resume, and start applying. Tell them that you want to work there. Why do you want to work there? Talk about it in your cover letter. Make sure that your resume has all of your transferable skills. So that way they know that you're serious. If you worked at a Dollar General and you did a lot of the balancing of like the deposits and stuff like that, that's something that you can put on there, that you're good with math, that you've done, work with the cash register machine, you've worked with the credit card machine, you've taken payments, you've done, order reviews and things like that. So those are things that you can put on there that can transfer over. Okay. There's a lot of people who start off in medical billing who had no background in medical billing at all. And I actually talked about that very thing in the video that the viewer commented on. So make sure that when you are asking these questions, you're actually watching the video so that way you can get my advice in there. Missy says that she enrolled into Auburn. Okay. All right. So, yes. Let's see. What else do we have here? But yes, that is my recommendation there on that, guys. You don't have to be certified to be a medical biller. And there's tons of medical billers who have their own businesses after they've had experience, and they're not even certified. And they're still very successful. So it is something to be said about medical billers. You're processing paperwork, you're negotiating, and you're getting the money from the patients, or you're getting the money from the insurance company, and you're being that middle person with the provider and the insurance. So it's a lot. It's a lot when you are a medical biller, but it's a good segue into your own business after a while when you do learn. Let's see. Catherine asked, I appreciate your videos. Quick question. Starting as a newbie, am I better off starting by taking a class in anatomy or medical terminology, or would you say the order doesn't matter? The order doesn't matter. But I believe I learned medical terminology first. Or maybe it was anatomy. No, it was anatomy that I learned first. And then I learned medical terminology. So either one, either order, you still need to have that. It's very important. There's no getting around medical terminology and anatomy. You have to have that. There is no negotiating out of that, because in order for what you're reading in the medical documentation to make sense, you have to understand what they're saying. It is all medical terminology with just a few little filler words, but it is all medical terminology. And if you don't understand what you're reading, you can make a lot of mistakes quickly. So that's why anatomy and medical terminology is so very, 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 very important. Let's see. Missy says, Blue, is it possible to be able to specialize in, say, forensics? This isn't like CSI, okay? Medical coding, while we have the different specialties, it's not like forensic science, right? And so when you say something like that, it's more of like the specialty. Like for me, I have done orthopedics and podiatry for the last 8 years now. So I would say I'm pretty specialized in orthopedics and podiatry. That is my favorite. I have done a lot of different clinics, but I would have to say that those are my favorite. My skills are very sharp when it comes to orthopedics and podiatry because I'm very sharp when it comes to that section of the book, the musculoskeletal section and the injury section. So when it comes to being specialized, you can, but once you've exposed your career self to many different specialties, then you can decide which one you want to do. You do not have to have a special certification for it. The only one that would have like a special certification would be like a tumor registrar or a trauma registrar. You know, like those, yeah, that's specialty. Yeah, that is specialized. Other than that, you don't have to have, I'm an ER coder, so I'm going to get an ER certification. Or I'm an ortho coder, so I'm going to get an ortho certification. No, you don't have to have that. I can walk into any place with my CCSP and say, I'm an orthopedic coder. Okay, great. Here you go, you know. Or I can walk in and say, I want to code in the pain clinic. Again, very closely related to musculoskeletal system too, and the nerves, because I've done neurology as well. So, you know, you can essentially go anywhere. And if you want to get more specialized in a particular specialty because you work in that, that's great, because it's really, the quality of the codes is going to be a lot better when the person truly understands that clinic. So, but hopefully that answers your question. You're welcome. And thank you for the blue hearts. So are there any other questions? Because I don't think I had anything else here. Nope. I answered everything. Alrighty. Okay, so I guess I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. Yesterday I was out, and tomorrow I will be back again for another show. So if you have any particular topic requests, let me know. Comment below. If this video helped you, please share it. Please like this for the YouTube algorithm. Subscribe if you haven't already, and I will see y'all on the next episode. Bye. Good night, guy.